Hey guys, it's me, National Nikki DST. A couple of months ago, I did a video regarding me taking my LCSW exam and passing on the first try. I got over 4,000 views and a lot of great comments from people telling me they would love me to do very similar videos like that in reference to careers, what I do for a living, and any tips and tricks that I can give them in reference to passing the test on the first try like I did. As far as a little bit of background about me, typically when you come on my page, I am primarily doing videos on highlighting my hair. So for those people who are new to my channel, I have sister locks. I've had sister locks for over 6.5 years. I started them in St. Louis, Missouri, by a wonderful consultant by the name of Tanisha Brown. And she maintained them until I moved. Well, I moved several times. And I currently reside in the state of Virginia. While in the state of Virginia, I obtained my master's. After obtaining my master's, I then started working on my hours to become a licensed clinical social worker. I've been in the field for, oh man, close to 10 years. And I've worked in every population you could think of known to man. And when I say that, I really do truly mean it. I have worked in the schools. I've gone to people's homes as far as doing in-home therapy. I perform various services there. I have also worked with active duty and veterans and their families dealing around substance abuse and mental illness. I have been a medical social worker where I've worked at a hospital. I've worked in the ER. I've worked in inpatient and outpatient performing individual, group, and family and couples therapy. Some of my specializations would include I'm a certified alcohol and drug counselor. Of course, you know I'm a licensed clinical social worker. I'm a certified clinical hypnotherapist, and I'm the youngest and only African American female in my area. So that's pretty cool. I'm also specialized and certified in EMDR, cognitive processing therapy, which I use with a lot of people who have a lot of trauma and combat issues. Some of my other specialties, like I said, besides addictions, is phobia, anxiety, depression, couples, mood disorders, and I pretty much have worked with every population known to man. I've done groups for pregnant women, expecting mothers. So I pretty much tell people that I work with somebody from the time they are born to the time they die. I've even worked with elderly populations as well. I'm a certified pre-screener for the state of Virginia, which basically means that I am certified to do a clinical assessment. During that assessment, I can determine whether or not an individual needs to be sent to a psychiatric hospital. I do crisis plans because in every case, everyone does not necessarily have to go to the hospital, but I just need some solution focused therapies. A lot of my I kind of use a plethora of different treatment modalities because I believe that there's no one set thing that's going to help someone. So I pride myself on trying to learn as many different treatment modalities and really perfect them so that I can help my clients to the best of my ability. So of course I do solution focus, cognitive processing therapy. I do dibble and dabble and didactic behavioral therapy, but I am not certified as a didactic behavioral therapist. So if you want to talk more about that, you'll probably have to talk to a DBT specialist in reference to that. But I do a lot of grounding techniques and things like that with my clients. Really big on doing a holistic approach on different things because I don't feel that everybody needs medication. So now, of course, there are some cases where individuals will need it. But if I can avoid that and we can just do some talk therapy, meditation, doing a lot of holistic different things to get that person their end goal, then that is my plan. I Currently, at my full-time job, I work with individuals who are dual diagnosis. By dual diagnosis, it means individuals who suffer from mental health as well as substance abuse. I worked in an inpatient before rehab, where I've had judges, doctors, lawyers, nurses. I currently run an aftercare group for professionals. They meet with me every month to discuss issues they have relating to substance abuse. I've piloted and charted a lot of other programs as well too, dealing around substance abuse, support groups, I'm currently also a supervisor or a lead psychotherapist at my job. So I do have some individuals that are under me that I supervise, along with, of course, my clinical manager. My ultimate career goal is to work in private practice part time, but also I would love to be a manager at the job. I love teaching people. I love being an advocate not only for the clients that I serve, but also for other up and coming therapists. I've always wanted to be a supervisor because I've had bad supervisors in the past. So I really want to give clinicians the ultimate tools that they need to be the best they can be. So I designed like an orientation package at my job to kind of help people when they first start on the job. They know exactly what they need to do, but I really go over it. I sometimes feel it as a social worker, we're so used to just being thrown in with no true proper training, and we just kind of figure it out. And I'm really trying to make that, debunk that myth. We do a lot of great things as social workers, but that's something that I really am true on, building true, great, clinical, competent future psychotherapists, or whatever their goals might be. And I also want people who are looking out besides just being licensed. I want you to go further than that. Like, for me, just because I got licensed, that wasn't my end goal. That was just the kickstart to more things that I had to come. So, literally, as soon as I got my license, I pretty much hit the ground rolling. I started launching things, started working on my website, started, working on the private practice, ended up getting really nice number of clients, under me for the private practice, which I feel is manageable for me at this time, as well as because it's not going into or taking up time from my full-time job as well either. But my thing is, I work full-time to make somebody else's dreams a reality. So I need to take out time for myself to make my dreams a reality. Although I love my job, nothing, I can say nothing but great things about it. But that's just kind of how I feel for me, I'm doing this for me. So, I just wanted to kind of give you guys that update. I don't really know if that was helpful, if I'm giving you guys the content that you want or even need, but that's pretty much my little story. If you guys have any questions, please feel free to ask. I do have a clinical website that you guys can check out and see. I'm currently listed on a couple of cool websites like Psychology Today, Therapy for Black Girls, and I just put things in to be a provider for another website as well too. So, but I'm not listed as of yet, so I won't really say that just yet. But all in all, I'm really shiny. So I hope you guys like this. Please let me know, like, subscribe, and give me feedback on that. If you want me to go more into about something else, please let me know. And I'm trying to do like a full view. My hair is getting so long, you guys. So for everybody who's been like a long time subscriber of mine, they really saw my hair at its humble beginnings. So as you guys can see, it's getting long. So I'm actually, my hair is actually now the middle of my back. So, yeah, that's my hair. Actually, it's probably longer than that. See? But yeah, all in all, that's pretty much my updates for professional, a little bit about me professionally, as well as more videos like this will be to come. So I'm probably going to do some series on different career developments, probably also hitting on different mental illnesses and cool ways people can remember these things. All in all, I hope this was helpful. I also hope I inspired you guys. Thank you guys so much for watching, subscribing. Don't forget to hit the like button and also comment below. Talk to you guys soon. Bye.